Okay, Linda, I think we'll get started. Good afternoon, everybody. My name is C.B. Wall. I'm a community innovation planner with the Sonoma County Adult and Aging Division and the Area Agency on Aging. I have the honor of serving as the facilitator for the Housing for All Ages and Stages Bold Goal breakout session and introducing our esteemed presenters. Before we begin, some housekeeping tips, some of which you've already heard, but please remain on mute. You may use the chat feature to pose questions. Our presenters will go first and deliver the presentations, followed by a Q&A session at the end. To provide some context to this breakout session, allow me to share that the Housing for All Ages and Stages Bold Goal is not housing-centric, as Debbie Toth informed us in her opening presentation. It encompasses an expansive set of strategies that, when successfully implemented, will enable all of us to, quote, live where we choose in communities that are age, disability, and dementia friendly, and climate and disaster ready. Our presenters today will home in on, pun intended, aging well at home. First up, Linda Jackson will introduce the concept of housing element in the context of Marin's Aging Action Initiative's activities. Linda is Program Director of Marin's Aging Action Initiative, a collaborative network of over 250 public sector agencies, community-based organizations, and healthcare providers. She has over 3 decades of planning experience with the cities of San Rafael and Austin, Texas, the Transportation Authority of Marin, and various nonprofits. She holds an MS in Community and Regional Planning and an MA in Latin American Studies from the University of Texas in Austin, and a BA from Wellesley College. After college, Linda served 2 years with the Peace Corps in the Andes Mountains. She currently serves as the president of the San Rafael Board of Education, vice president of the League of Women Voters, Marin County, and on the boards of Sustainable San Rafael, Housing Crisis Action, and Marin Environmental Housing Collaborative. She and her husband live in San Rafael, where they raised 4 girls. You're on.
Oh, thank you so much, CB. Ready to go. I am going to talk about housing element updates. And this is a process that doesn't happen very often, but is perfectly timed for us in the aging advocacy world. And so I see that we have somebody who will be doing the slides for me. So I'd like the next slide, please. I do not. Yes, thank you. Can you bring up the next slide? This will be a quick review of housing element updates, which is a major project. So I'm available afterwards for any questions. What is a housing element? Well, it's simply a plan for housing in your community. Not only that, though, it's an important part of planning in the eyes of the state. They've required local jurisdictions to plan for housing since 1969. It needs to plan for all income levels. It has all kinds of maps and programs and policies, and it has to be updated every 8 years. So the next plan is going to go from 23 to 31. The next planning process will start up in about 8 years from now. So next slide, please. One of the terms that you are going to hear in housing element planning, back one, is affordable housing, perfect. Affordable housing is a term that is a state of art in planning for housing, and it means that 30% of your income equals an affordable housing for you. So you could think of how much you pay for rent and see whether you are paying, you're living in affordable housing for you or not. However, we know that for older people, they also are paying for food and internet. They're paying for health care that's not covered by Medicare. They're paying for caregiving. We know that older people live on Social Security, which does not have the kind of increases, cost of living increases that match rent increases in our counties. And finally, we also know for older people who rent, when the partner passes and lose half the income that can go for rent, that puts older people in danger of having to lose their home and living in their community where they've been living for decades. Next slide, please. The intersection of ageism with other isms that we're so aware of these days is really captured by Isabel Wilkerson in her book Cast. I was reading the book, and towards the end, this paragraph leapt out at me. Even the most privileged of humans in the Western world will join a tragically disfavored caste if they live long enough. They will belong to the last caste of the human cycle, that of old age. People who are among the most demeaned of all citizens in the Western world, where youth is worshipped to forestall thoughts of death. A caste system spares no one. And this is why we have to stand up and advocate when it comes up to housing planning in our communities. Next slide, please. There are some data that to be aware of in your community. So this is from Marin, but you can easily find this out for Sonoma, Solano, and Napa counties. In 2016, 47,000 people in Marin were 60 or older. 44% of them owned a house. But for homeowners who were 65 and above, a third of them were paying more than 30% of their household income for their housing. For renters, it was far worse, almost 60%. Median age at this time in 2010 was only 44, and now that's increased 3 years, and that really matches with the data that you saw at the beginning. Next slide, please. Here's another way to look at aging in Marin using projections. You can see that at the far left, in 2010 in Marin, we had about the same number of young people as older people. And if you look at the center with the orange dotted line, now we have almost twice as many older people as younger people. That's because we're all growing older in our homes, and there aren't any options in Marin really to downsize into. So families aren't able to move in behind us in the homes that we had. We sold our house a couple of years ago. We sold it to a young couple, and now they have a child. We live in one of the last new units that were built in downtown San Rafael, waiting for some more. Next slide, please. So to start off in advocacy, it's good to know what your values are because you can speak to those to tell your stories. And these are the values that we have in AAI. People who have lived and worked and raised families in their hometown deserve to have housing and family and neighbor and caregivers nearby that they can depend on as they grow older. And we value the contributions of older people in our communities, and we want them to continue to enjoy, yes, the euphoria that comes from knowing that the rest of their lives will be in safe, affordable, and comfortable homes in their hometown. Next slide. So I'll spend a little bit of time on this slide. This is from the County of Marin. It's an excellent timeline, but I can assure you that in every city and town in your county, they have something similar. This is the timeline to prepare the housing elements for their community. And so you can see on the far left, right now, everybody in the Bay Area is gearing up to plan the plan. They're deciding what kind of public process they're going to have. They're contracting with consultants. They're figuring out what the budget will be. And in the fall, they start doing the background work. They'll launch the community work, their outreach. They'll convene the stakeholder committee, perhaps. You might volunteer or seek a volunteer to serve on it. And then in the county, at least the next step will be doing the bottom two, I think are very important. Updating their data and doing some site work. Updating the data in a housing element. By state law, your jurisdiction is required to analyze the housing needs for what they call seniors. So for older adults and for people with disabilities. These are two groups, and it's important to make sure that that data is well covered in your housing element. Then a year from now, We'll start getting into drafting the document, environmental review. The public hearings will happen probably a year and a half from now in next fall. So there's a lot of preparation to get ready for, but there'll be community work along the way to speak up and say, don't forget, we need options for older people in our town. Next slide. So there are lots of options of what to do. And this is a list. You can get this PowerPoint later. I won't go through all of these. I'll just note on the upper left is a garage apartment that my husband and I lived in, and it belonged to an older woman who lived in the main house. And she built this unit actually for herself to live in when she became older. And the middle is where I live now. I live in a mixed-use building in downtown San Rafael in one of those apartments. And at the very bottom is a tiny house village that's in Sonoma County that provides options for housing. So there's a lot of different ways to do it. It totally should be tailored to your town and what the scale of your town and what is the consensus of the community for the best way to provide more housing. Next slide. And so I will end with another quote from Isabel Wilkerson, because this is how she speaks about it in her book. Even the longest lived of our species spends but a blink of time in the span of human history. And how dare anyone cause harm to another soul, curtail their life or life's potential when our lives are so short to begin with. This is why it's so important to be standing up and speaking up for older people in your communities. And I hope I'll be love to answer your questions about how to do that when we get to the Q&A part. Thank you so much, CB.
Thank you, Linda. I learned a lot about housing element in less than 10 minutes. Test at 11. Next up is Rachel Guinness, who will share information about accessory dwelling units. Rachel is a LEED accredited residential designer and licensed general contractor. She introduced an innovative model for flexible housing called junior accessory dwelling units. JDUs, am I pronouncing that correctly? Offering an affordable option for renting and owning a home in California. She consults with homeowners on development of ADUs in the Bay Area and is currently working with Hello Housing as the senior construction project manager for their Bright in Your Own Backyard ADU program. You're on, Rachel.
Well, hello, everyone. Thank you so much for having me. Yeah, I just want to point out, I also have a crazy collection of credentials around energy efficiency and home performance. And I think that home performance is so important for human health, but also very, very intent on creating resilient communities. So I was actually an early pioneer in the ADU movement, working in Marin to pass permitting code for junior units or JADUs, as they're known in local permitting code. We went on to pass state law, and Linda Jackson, who spoke just before me, was actually right by my side while we testified to the state Senate. In fact, both Marin and Napa counties were among the first to provide favorable loans to incentivize ADU development in return for some specific community benefit, reduced rents. I want to recognize and commend them for that. Napa was also one of the first to look at housing through the lens of a human health initiative. I think we have slides for me. Is there somebody doing slides? I didn't see slides pop up. Anybody?
Oh.
There we go. Thank you. Thank you. Actually, that just shows our affiliations. San Mateo County was, kind of an early adopter of the ADU movement, and people have been playing catch up ever since. So it's great to see the work that people are doing. So next slide. So tremendous work has been done to foster the development of ADUs, but these units are part of a larger spectrum of opportunities which exist in the shared housing space. Going from lowest to highest cost of investment, home sharing offers the most affordable housing option and can be rapidly deployed to house individuals, many of whom are on the scary edge of housing. Junior units represent the most affordable independent living opportunity from both a development and rental perspective. They are the least, they use the least resources to create, and they offer the greatest energy efficiency because they utilize existing living space in homes. ADUs, whether they are attached or detached, span a higher range of costs and are more resource intensive, however, still provide a new meaningful source of sustainable, naturally occurring affordable housing in high opportunity, hard to develop communities, tongue twister. They also act as a stabilization tool in rapidly gentrifying neighborhoods and an asset building strategy for low and moderate income homeowners, and are an exciting source of local jobs and growth for small businesses engaged in expanding this housing form. And new state law now allows for both a junior unit and an ADU to be added to single family properties throughout California, creating 3 residents in all. These units are providing stable, permanent and rental housing for populations hardest hit by the pandemic-induced recession, including many older adults. In our program alone, we have spoken to over 150 households in the past year. Over 58% are building ADUs to support family members. This includes adult children building ADUs for their parents and seniors building more accessible ADUs to move into while their adult children move into the main house. This percentage grew from just under 50% to 58% as a result of COVID and the stated desire to move family members out of congregate care environments or group living situations. Next slide, please. So let's look at the tools that have been put in place in the 4 North Bay counties to facilitate this movement. Sonoma, Napa, and Marin have done tremendous work to help encourage and support development of these homes by creating interactive websites that offer information and resources. I hope to see Solano County follow suit, but I did not see anything on the internet for them. But they can certainly look to the Napa Sonoma ADU Center and Marin ADU website as a template. These websites offer inspirational videos of families who have built ADUs, idea work and guidebooks to help homeowners through the process, as well as floor plans and budgets, a consumer-friendly web calculator, and links to permitting code by jurisdictions. Some also offer feasibility assessments to let homeowners know what they can build and can answer project-specific questions. Jurisdictions are also looking to create pre-approved plans that will allow homeowners to save money and time. Together with new ADU laws, these websites have helped to create a considerable boom in ADU development. But even with all of these amazing tools, it is only the most intrepid homeowners with access to investment capital who are the early adopters with enough time, resources, and experience to take on such a complex project in a volatile and dynamic market. Next slide, please. Incentives, creative financing institutions, and technical support are needed if we are going to fully unleash this opportunity and bring low and moderate income homeowners to the table, including older adults who are near to or in retirement. They do not have the same access to financing options. They are working with thinner margins, and many lack the experience needed to manage such an overwhelming project. The work that we have been doing at Hello Housing offers homeowners a trusted advisor on projects that require a customized approach. We wish to replicate and scale this model throughout the state because we have seen the difference it makes. Nonprofits are uniquely positioned to facilitate communication among private interests, government agencies, and the public. Contrary to other third-party professionals, we act as a neutral, unbiased party, offering a wider lens by providing referrals, oversight on design and construction contracts, services, and billing statements, while facilitating greater communication between parties. We help homeowners understand all of their options, from inspiration to occupancy, so they can capture the greatest value, flexibility, and livability in their investment. This professional guidance, in combination with access to new, more inclusive financing options, give gives homeowners the opportunity and confidence they need to embark on a project a project of this complexity and magnitude, sorry. And there is a range of new loans coming into the market that are rethinking the loan to value ratio because financing institutions are allowing future value and income to be used to qualify for not only housing, but also energy efficiency upgrades. This has the potential to create a new, powerful financing tool for sustainable development. Next slide, please. If we are going to expand this movement in a way that includes a diversity of people of all ages and stages of life, we need to incentivize development, offer creative financing tools, and provide homeowners with the technical assistance needed for them to lend their land, time, and resources to create our most affordable housing, enabling older adults and families to sustain and enhance independent and healthy living in their own homes. This will provide savings for residents and Medicare payers with lower costs of care, decrease emergency room visits and hospitalization, and postpone the need for increasingly costly assisted living and long-term care. That is what I have for you today, and I'm happy to answer any questions. Thank you so much.
Thank you, Rachel. That was really inspiring. And from a newcomer from the East Coast, these accessory dwelling units are exciting prospect to consider. So thank you so much. Before we move forward, just reminding everybody to please, if any questions are popping into your mind, take advantage of the chat because we'll be taking your questions at the end of the breakout session. So now Celine Regalia will present on the Dementia Capable Napa County program. Celine is the Executive Director of Calabria Care, a leading center for community-based care delivery and resources in the North Bay for those facing transitions of aging, Alzheimer's disease, and other serious illness, or the end of life. In her previous role of Director of Operations, she was responsible for new program development and implementation and evaluation of cross-organizational processes. As program director, Celine was instrumental in building Calabria Care's innovative, award-winning Calabria Day program and Alzheimer's Day Care Resource Center, which she headed for over 20 years. She has successfully developed collaborative partnerships with local community organizations, expanded outreach and community education programs, and has been co-chair of Napa County's Healthy Aging Population Initiative since 2005. Celine holds a master's degree in medical social work, as well as both a bachelor's degree and master's degree in speech pathology. Welcome, Celine.
Thank you, Stevie. Good afternoon, everyone. I'm honored to be able to present to you today our Dementia Capable Napa County project. And I know my slides will be coming up. So Dementia Capable Napa County came about through a grant through the Administration for Community Living, which we received in 2019. We've been an Alzheimer's Day Care Resource Center in Napa County since 1999, working not only with caring for people in our center, but also working in the community to improve the quality of life of people with a diagnosis and the caregivers. What this grant has really allowed us to do and how it connects to what Debbie was talking about is really that age and dementia friendly community, and many things in an age friendly community are also in a dementia friendly community. And also with this grant, the Administration for Community Living has provided all kinds of technical assistance, and we are linked with the National Alzheimer's Disease Resource Center so that we can get best practices and meet with people from all over the United States to see what they're doing in their communities and introduce that into our communities and share with our partners. Next slide, please. So when we started this project, we came up with our vision statement, and it really was building on the as I said, the 21, 22 years of being an Alzheimer's Day Care Resource Center and the things that we knew that still needed to be done. I mean, the work is never ending. So our vision was, with the implementation of dementia-capable Napa County will become a community in which people living with dementia and their families are empowered, included, and respected, and have access to supportive expert resources so they can live their best possible lives. And the objectives of this project will be achieved in various forms through education and training and other initiatives that we continue to develop. Next slide. And so this model, this demonstrates the model and how we're operationalizing it. So we are building community. We're working and meeting with our other organizations in our community to inspire them in this work to be more dementia friendly. We're engaging expertise, as I said, throughout the United States and in our community to bring more people to the table, and we're growing those partnerships. And we're really looking at the people living with dementia and their care partners, and with the goal, as we were talking about, the diversity, equity, inclusion, to achieve social inclusion, challenge the stigma, improve care and services in our community, and increase awareness of what it's like to for people with dementia and what it's like for their partners, so that they can feel like they are part and living within community. Next slide. And so I just wanted to show this because these are the goals of Dementia-Friendly America communities. So we are really kind of aligning with some of the similar things. I think the work that we really are still need to focus on are the last two bullets, to create the social and cultural environments that are inclusive to those living with dementia and improve the physical environment. But I would say that our project is really touching on all of these, but there's still a lot of work to be done. Next slide. So one of the focus, and where it's a little bit a different angle in terms of the housing goal, is one of the big focuses of our project is how to help people or identify people who are living alone in the community and people with intellectual disabilities who are at risk for Alzheimer's disease or related dementia living in our community. And how can we provide services and supports for them so that they can remain in their homes. And so what we have developed in our project is we have a medical social worker that's part of this program that does case management. We have a community health worker who is bilingual, bicultural. And what they do is they identify, they create care plans, and they provide wraparound case management services for people living alone and identify what those needs and connect them. We are also the provider for information and assistance in Napa County. So there's really a nice linkage between all of our programs. And we've really tried to build this integrated system within Napa County. And that's what HAPPY has been about, the Healthy Aging Population, is we've really looked at the partnerships in our county, what are the strengths of each organization, and then how do we make these integrated systems so that it's a warm handout and people get the right care at the right time or get the right service that they need in the moment. And so with this, information assistance might be the door that somebody walks in and then they're referred to dementia capable. And we were able, with this grant, that's Melissa, and she is our program manager for dementia capable Napa County. And we were able to hire a position, and we were able to hire a social worker, and we were able to hire a community health worker, and we will be able to sustain those positions. We were also able to expand some services in the day program that have to do with quality of life. So they're evidence-based programs. We have the expert who created those two evidence-based programs, and she consults with our team. So it's RDAD and STAR-C, and RDAD is about increasing mobility to reduce falls and engagement with people and wellness. And STAR-C is around behavioral interventions that we do coaching and training to build the skills and confidence of the caregivers. And our next step of that, right now we're doing it in our day program, but the next step after the grant's over, we'll be bringing those interventions and best practices to our community. We provide family consultations and follow-up, and we host a ton of community-based educational workshops on dementia. And then another part that we really wanted to partner with is we knew that Queen of the Valley, and there's another session on that today about the geriatric friendly ED, was to really partner with Queen of the Valley to make them a dementia-friendly hospital. So far we've done trainings with nurses there. We're working on doing the discharge planners, and we're working on some integrated systems that we can have so that people that go in the hospital are identified and can integrate successfully back into the community with the services and supports that they need. And then finally, this is a big part of it, is our Napa County Navigators training. So it's really about engaging everybody in the community. It could be a coffee house, it could be a hairdresser, it could be Target, anybody who wants to go through some of these Napa County Navigator trainings. There's different levels. So we have it for professionals and for the general community. And one of the things, one of the examples is we were able to do the North Bay Regional Center, especially focusing on the people with intellectual developmental disabilities, and train people. And we did a series of them. And we've done other capacity building for other organizations so that they are able to have more skill in working with people with dementia and their care partners. Next slide. So this is a project team. If you want to contact any of this, there's a lot more involved in this project. The living alone was kind of what we were highlighting today related to housing. Next slide. And that is our team of beautiful people. So in our backyard at Collaborate Care. So Jill in the middle is our program director of our day program now, Melissa, as I said, and we really thank you for listening to this, and we hope that we can inspire communities to be more dementia and age friendly.
Thank you so much, Celine. What important, impactful work you all are doing. Also very inspiring. And I'm sure everybody who's listening to this presentation sees how there's so much crossover in the strategies in these bold goals. So I see a lot of this fits into addressing the Health Reimagined bold goal, and not only the housing for all ages and stages. So thank you for your presentation. We are ready to start answering your questions. So please take advantage of the chat and pose your questions to Linda, Rachel, or Celine. And as we're waiting, I noticed in the chat, somebody had put in some demographics. Amy Appleton, showing that a quarter of Sonoma County's population is 60 years of age and older. 1/5 of the population is 65 and older, and 36,000 individuals are 75 and older. So from pyramid to pillar we go. Someone is saying, let's see, Jody says, I believe that you can't create a junior ADU from a garage. Is there any action to change this? I think that's directed at Rachel.
It's actually jurisdiction specific. Some are allowing junior units to be created in garages, and some are like saying or defining it more strictly. So you would want to check in with your jurisdiction on that.
And then how do you think other providers could access funding to bring in staff to implement some of the same things you have at Collaborate Care? Do you see local counties funding or foundations, or perhaps the 400 billion infrastructure plan? Celine.
Well, I think there's a lot of, I think there's a lot of opportunity. And as Debbie, you know, I think the ADCRC legislation that we're going for to really bring back the centers of excellence, we've been able to access some of our funding through master settlement agreement money, so tobacco settlement funding for some of our programs locally. And for the information and assistance. And so we've had some creative ways of kind of bridging our own integrative that. And now we're part of Providence Health System, and they are really driving this age-friendly health system with the 4 M's, and now they've added 5 M's, malnutrition. And I think that the Institute, I'm sorry, it's IHI, and I'm acronym dead right now.
Institute for Health Improvement.
Yeah, thank you. Thank you, Steve. So we just had in our health system, we just had a forum on that. And so they're putting out in our health system, they're putting out $100,000 kind of almost like Shark Tank, like do a proposal. What are you going to do within your programs and services to be age friendly? So I think there's lots of opportunity to jump on some of those synergistic things that are going on in healthcare and at the community level, and partnering with the county to fund and show them why this is an important work.
Thank you. I have a follow-on question to that before I get to the next other question, unrelated. So you mentioned you're part of Providence Health System. So
Mhm.
are there sister Calabria cares in the neighboring counties?
We are, they have, we're in the home and community care footprint of the health system. So home health, hospice, adult day health care is part of it. They're also one of the largest providers of PACE. So we're the only ADHC in California that's part of Providence, but they're in Washington and Oregon, and we're looking at bringing, PACE to Napa County. And so that's our newest project at Calabria Care that we'll be working towards.
Okay, thank you. Question for Rachel. Do you have statistics on how ADUs have grown in the past years, specifically in the North Bay?
I actually don't have off the top of my head specifics on that. If you went to the Turner Center for Innovative Housing, they recently wrote a report that that can point to those numbers. I know that development is happening a little bit slower in the Bay Area just because of the cost of construction. So it's other areas of California are kind of leading the charge as far as numbers.
I speak in San Rafael. Maybe about 10 years ago, the city of San Rafael used to approve maybe 3, maybe 4 ADUs a year. And the last few years since state law changed, they've been approving over 30 a year. This has been the last few years the only housing that's really been built in Marin County. So.
And you also, Linda, shared in the chat some resources for ADUs in Sonoma and Napa and Marin. So
those are public.
Okay.
Yeah, those are the public sites in Marin, and then there's one for Napa, Sonoma. I couldn't find one in Solano, and then Rachel's organization will help people go through all those stuff. So the Trusted Advisor, which is a fabulous standby partnership for homeowners. There is a question there about Board of Supervisors in Marin. So each jurisdiction is doing their own plans. So no, in Marin County, Marin Board of Supervisors are all about their housing element for the county, but they're not doing housing planning for the local jurisdictions. San Rafael, Sausalito, they all do their own. But the county is a voice overall for speaking up for the need for affordable housing and offering programs such as what Rachel talked about, vouchers, rental support for people who put in an accessory dwelling unit as an example. So in your town, if you live in the county's jurisdiction, the county will be doing your housing element. But if you live in Santa Rosa, the planning department for Santa Rosa will be doing the housing element.
Thank you. How are the conflicts between county and local jurisdiction housing policy being resolved? You want to take that
Very
one?
Very carefully. Those are long discussions that happen. Hopefully in the public realm, but probably a little bit behind too, the scene. So yeah, the county, but again, the county doesn't have jurisdiction. Now there are, in the planning world, there are areas around each jurisdiction that are called planning areas, sphere of influence, and the county has the state law requires the two jurisdictions to talk to each other and talk about what should happen in the future of that land. So that like I say, those are very careful discussions, and they do have a final decider is going to be the jurisdiction that ultimately governs that land.
So do you or Rachel have any advocacy recommendations?
Well, in terms of, for the housing element, I would say look at what give your local planning director a call and find out where they are in starting up the housing element process. Find out across the Bay Area, all the city councils right now are having agenda items where they're talking about hiring a consultant, talking about the budget, adopting the time frame, like I showed from the county of Marin. So that's happening, and you can find out that easily by checking in with your local planning department. And then seeing if you or somebody that you know who's an advocate is willing to serve on the advisory committee and be a voice. There'll be public meetings and public engagement efforts everywhere. So showing up and speaking up from those values that you have for needing options, what Celine talks about. A dementia-friendly communities needs to be in every single housing element. And every jurisdiction, that's just me, but every jurisdiction should be talking about how to help people stay at home as long as possible.
It's a great...
Rachel, advocating for ADUs, that's still a big one.
Advocating for not only ADUs, but shared housing. I mean, shared housing, it's like the easiest, most cost-effective, no construction needed. And, it's stepping stones to housing, right? And so there still needs to be a massive push, like I was saying in my presentation, like only the most intrepid, financially prepared people are entering the ADU space. If these counties and jurisdictions are serious about adding ADUs to their housing elements, which they should be, for a small, a public investment, we could create costs about $20,000 to $25,000 for project management oversight to help somebody create an ADU, right? So, but to create a multifamily affordable housing unit, you're looking at $500,000 to $700,000, right? So you're talking about, and you get, the public benefit back from, these resources. So anyway, we have to make a serious push if we're gonna see this happen in jurisdictions. I mean, they're doing all the right things, but it's really going to take a considerable effort.
Well, you just got a big shout out for the work that you did legislatively, Rachel, and I see Debbie is chiming in about how we need a continuum of options.
So yes, there are many, many options, but they're going to vary differently. So what Sausalito sees as a good option is going to be completely different from what Santa Rosa sees as a good option. It really has to be tailored to your town. We're talking about mixed use infill housing. Well, everybody loves that idea. In some towns, that's going to be a 2-story or 3-story building. In some downtowns, it might be a 4 or 5-story building. So it has to be entirely tailored and come out of what a community is scaled to that community. But yes, there are many, many options out. But what we can bring as older people, advocates for older people, is that lens of what older people need as they age at home. When you're 30, your needs are completely wrapped around, your work and your family and your friends and what you're doing. And it's hard to imagine what it would be like 3 or 4 decades from there, what you would need to be happy in your house for your home.
Say, CV, that, in the case of San Mateo County, the county itself kind of led on this initiative, and they put out matching funds, and they invited the different jurisdictions to come on board, which 3 of them, did. And so, even though, Linda could not be more correct, every jurisdiction sets their own, agenda. However, counties can lead, and to create this initiative. Yeah.
That's true.
Speaking of leading counties, I see something in here about the age-friendly Marin Forum. Where can you say a little bit more, Patty, about where one might learn more about participating in that? If you can just type it into the chat, that would be great. for everybody to learn more about that. 70% of share Sonoma County home shares surround services in exchange for housing, allowing the aging homeowner to remain home safely and thrive. Wow.
Right.
That's great. Okay, is anyone working on support to seniors who open a room to shared housing and have problems with a tenant? California has some strong tenant rights laws, and a lot of homeowners are scared of taking on housemates or tenants for an ADU.
So there are organizations set up like Share Sonoma, and I'm sorry, Linda, what is the one I just read about it that is working in Covia is working
Covia.org.
to match people. Yeah. So again, these I don't understand why why people aren't just throwing money, frankly, at at the shared housing, these nonprofits who are like they're doing the most amazing work and creating housing at the lowest cost for the people who are most at risk. It's impressive. I sit on the board of Share Sonoma, full disclosure. So anyway, I just, I mean, obviously as a designer and builder, like pioneer in the ADU movement, I'm like, I love the independent living space and totally see the value of that. But, it's on a spectrum, right? In the shared housing movement, and just home sharing is, just such an excellent solution.
Covia.org has a very intensive matching program. So they'll advertise a room and what the situation is, and if someone wants to say, "Oh, I want to be in there," Covia has a survey that people fill out about all their life preferences, and they'll meet with the folks to make sure they get along, and they work out house rules. And there's a lot of off-ramps along the way for the homeowner and protections. And then they're there for helping them out. It's obviously not going to be for everybody, but it can be a wonderful experience. And I just hear such good things. We have in Mill Valley, they have contracted with Covia.org to help Mill Valley residents who have a house find someone who can live in there with them, and like Celine talks about, have somebody who's there to keep you company and help you play chess at night. We're running out of time. So.
Oh yeah, the stories that I'm hearing out of the work that Sheriff Sonoma is doing, they're just they just break your heart. I mean, in the best way, right? I mean, they're amazing. Yeah, I just can't say enough about it. It solves so many problems. It creates community. They have, you have help. You're obviously helping to, pay your bills. Like long-term friendships have been created, and the organizations who do this are so skilled at creating these matches. I mean, it really is, a safe harbor and like a wonderful opportunity for so many people.
We have another resource from Jerry, National Shared Housing Resource Center. You guys filled this space so brilliantly. We're going to be booted out of here momentarily. I can't thank you enough.